Hello, I'm Satare Talai. I'm 15 years old. I'm a student at IAU and I've been working in the field of artificial intelligence and programming for 3 years. One of the main reasons I was interested in this project is that my father is a gastroenterologist and I've witnessed the challenges of his work up close. Performing endoscopy procedures is very challenging for Iranian doctors. Excessive pressure and the precise adjustment of the endoscope can cause wrist injuries for doctors. This process is time-consuming and biopsies are usually performed in several stages, which increases the workload. On the other hand, seeing Iranian patients also made me aware of their numerous problems. Some patients have to visit the doctor several times just for polyp removal. Post-polyp removal care is sometimes difficult and high risk, and post-operative bleeding occasionally occurs. In addition, the cost of treatment places a significant financial burden on patients and their families. Our project is the design and development of a smart endoscope device that, using computer vision and deep learning, can automatically detect and classify abnormal tissues such as polyps during endoscopy. In the first phase, the device enters the body through the endoscope and, using a high-resolution camera, captures real-time images of the internal environment of the digestive tract. These images are analyzed and scanned by an artificial intelligence model that has been trained with real clinical data. Our algorithms are capable of detecting polyps based on their shape, color, texture, and location, and can classify the type of lesion accordingly. For example, dryness, suspected malignancy, and so on. It also takes a biopsy from the polyp. In the second phase, when a polyp is detected, the system alerts the physician. After observing and confirming, the physician can choose one of two treatment methods. These are precise cauterization using electric current or freezing the lesion at extremely low temperatures. This procedure is performed using a controllable robotic arm that is integrated into the endoscope. All stages of treatment are performed with minimal invasiveness, without the need for incisions or traditional surgery, and without bleeding. The key advantages of this technology include reducing human error, as detecting polyps can sometimes be difficult with the naked eye. Artificial intelligence significantly increases diagnostic accuracy. Second, reduced operation time. The doctor only needs to make the final decision without having to pause to analyze the images. The scanning and diagnosis process is performed in real time. Third, with minimally invasive and bloodless treatment, unlike traditional methods, damage to surrounding tissues is almost zero, which reduces risk and lessens the need for post-operative care. Fourth, greater convenience for the doctor. The strain on the doctor's neck and carpal tunnel in the wrists is reduced since the device's controls are largely automated. Fifth, lower patient costs. By eliminating multiple visits and reducing hospitalization, the overall treatment cost decreases. Sixth, potential for integration with digital health systems. It is possible to store information and results in the patient's electronic medical record, which is very useful for future follow-ups. Seventh, the technology is expandable to other fields such as colonoscopy, bronchoscopy, and other branches of internal imaging. In fact, the intelligent detection engine of this system can be trained for various types of lesions and different parts of the body, which opens up broad commercial and research horizons for it. This system can create a revolution in the processes of early diagnosis and treatment of gastrointestinal lesions. By combining biomedical engineering, artificial intelligence, and clinical experience, this project can be a leader both technically and in terms of human impact. It can significantly improve the quality of life for both doctors and patients. Thank you for watching this video.